Hello, my name is Hope Scruggs. I'm currently attending Spring Arbor University and their MBA online program, and I'm very excited about coming to a close with that chapter in my life. And this is my living case study presentation. The title of the living case is Factors That Impact Burnout and Stress in Emergency Services Nursing. One of the first things needed to take place with this process was to identify a problem statement of which to center research around. For my host organization, and I'll refer to them as the ABC Hospital throughout this presentation, I knew I wanted to do something centered around nursing. So I took a look at the turnover rates of nurses in the different specialty areas, and I compared that against a benchmark in the healthcare industry known as the Nursing Solutions Inc. for the year of 2016. In my review, I uncovered that for the specialty area of emergency services at ABC Hospital, their turnover rate seemed to exceed that of the Nursing Solutions Inc. The turnover rate at ABC was about 24% versus the benchmark at 21%. So therefore, I focused in as that being the problem area and tried to look at what things might contribute to high turnover rates, and identified that a high indicator of that is burnout and stress. So I used burnout and stress basically at that point to look at that as my dependent variable for research. So the overall research question for this study was, what practices increase risks of burnout and stress in emergency services nursing? And I took a look at what factors contribute to that and their impact. The factors, or what's termed as independent variables in this case, were workload, because it involves tenuous hours, 12-hour shifts, and just the hectic, chaotic environment of being in emergency department, which leads me to the next independent variable, which is that of work environment. The third independent variable is years of experience. And the last independent variable for this research study is that of organizational support. So the overall goal was to see what impact did they increase or decrease burnout and stress. Some of the benefits of the study involved the stakeholders, and that really went at all levels, which included the nurses as individuals, from a group level, meaning middle and upper management, as well as the organization as a whole, ABC. So nurses will benefit from the supportive work environment that kind of comes with maintaining a positive health of the nurses. And management benefits from being armed with information to stay aware of the symptoms and make informed decisions to combat the problem and help implement resources to reduce levels of stress in nursing. And lastly, the organization benefits in the form of physical strength as well as financial strength, having the strong mental health of the staff, as well as reduced labor costs and increased reimbursement around good service being provided. Nurses that work in a healthy environment are able to provide a better level of service to the customer, which is the patient. And overall, that seems to trickle down and have greater effects in terms of exposure of the hospital and more patients being willing to come to a hospital because it's a hospital of choice and good service provided. The next slide is the conceptual or theoretical framework, and this just gives a visual display, again, of the dependent variable, that of burnout and stress, and the independent variables that will be explored, or the goal initially was to explore these at the onset of the study, which included, again, workload, work environment, years of experience, and organizational support. The research design methodology selected was that of quantitative, primarily because it explores relationships and connections between different variables, of which I was interested in doing that with the independent variables previously discussed. The sample method identified for this particular study was that of self-selection. The population for the emergency services nursing at ABC Hospital was that of about 50 plus staff, composed of full-time, part-time, and casual employees. So the author decided to do self-selection and invite all of the staff to participate. That was done at a staff meeting, which I attended, presented the study, the purpose for the study, and answered any questions that any of the employees may have had at that time. Data was collected via a questionnaire. The author, or myself, I used the MBIH Human Services Survey as well as the Pro Quality of Life Survey, and I combined them into one questionnaire for the purposes, and I also added questions around organizational support. So combining all of these questions together in one, making one questionnaire out of all these surveys. So I handed these out to the staff and invited them all to participate. I stressed the importance of anonymity, hoping to encourage them to be authentic and honest and be more willing to participate in the survey. In their work area, I left a locked, secured ballot box of which I only had the key for about a 2-week period to allow them to, if they decided to participate, to leave their responses. The informed consent was that of, they didn't have to sign anything. Again, the goal was anonymity to make them feel safe and secure and protected. So merely them returning the survey was indicative of them understanding their rights in the informed consent. Overall, the response rate was not as optimal as what I had hoped. It was only that of 27%. And again, it was about 50 plus staff that it was handed out to. However, I did take the information and I did perform analysis on the information to try to identify patterns or trends to see if there was enough information to conclude on the hypotheses and to validate some of the initial assumptions that I had going into the study. Overall, as stated, the response rate wasn't what I had wanted it to be. And therefore, I also looked at secondary research to supplement in this case. But from the findings from the data collected from the emergency services area at ABC Hospital, between the two surveys used, the MBI and the Pro Quality of Life, I was hoping that they would corroborate one another. So therefore, with workload, they both did that in the questionnaires provided. And it came out that workload in this case did not increase burnout and stress, which seemed to point to the fact that the respondents for the survey did not seem to exhibit burnout and stress, which is a good thing for ABC Hospital. It is well known that with the survey, workload is a contributing factor to burnout and stress through both of those surveys. But again, in this case, if burnout and stress is low, then it wouldn't point towards that. So again, a positive finding for the organization. The second independent variable of work environment was quite interesting. The results seem to not corroborate themselves between the two surveys in the questionnaire. So in one sense, responses were indicative that work environment was increasing burnout and stress, and on the other hand, that it was decreasing. So I felt the response didn't really show a significant conclusive pattern in this case. The other independent variable of organizational support, it seemed to indicate from the responses that they felt that organizational support at ABC Hospital and emergency services was high. So it pointed to that organizational support being high actually decreases burnout and stress, which actually goes in tandem with the results of the workload factor, because if organizational support is high and you have decreased burnout and stress, that definitely kind of corroborates itself with the results we got from the workload factor, that it didn't seem the workload in emergency services did not point to burnout and stress. So they seem to work together, and it made sense, the results did. Lastly, the independent variable of years of experience. Unfortunately, since the primary goal for myself with the survey was focusing on anonymity and making sure the respondents or those invited felt safe enough to participate, questions were not put in the survey around years of experience for fear that it would compromise anonymity and in some kind of way allow the results to be able to be pointed back to specific employees. So because that was the goal, I didn't add additional questions that asked around how many years you've been working or working at the hospital. So there really wasn't, of the data results I got, nothing to really show any new information on years of experience. The limitations from this study really ranged in three particular areas. So the first one being that years of experience, again, was not really as much focused on the survey or the questionnaire as what I initially wanted it to be. So again, way to have overcome that would have been to be okay with compromising a little bit of anonymity and add the appropriate questions in the survey that point towards years of experience and identifying that in the questionnaire. The second limitation was really on the response rate. Again, the author was really, or I was really focused on anonymity and trying to increase the likelihood of responses. However, I think in hindsight, if I had considered possibly adding a small gift card as a proponent to increase the likelihood of those responding, as well as possibly considered asking management to allow 10 or 15 minutes at the end of the meeting and staying to allow them or ask them definitely to complete the survey. So these couple of things could have contributed more positively to increase the number of responses in hindsight. And then lastly is the research design method. I was focused on quantitative methods, but again, looking back over it, it's possible that had I entertained using mixed methods of research, meaning also using qualitative measures through interviews, I might have been able to gain more telling information around it, even though the response rate may have been minimal. So again, I believe I could have overcome that by being willing to take the extra time to use mixed methods research. Recommendations for the host organization really stem around those of preventative and reactive. So overall, it's important that to have a strong nursing management, and having compassionate and helpful managers really decreases the amount of burnout and stress. And it's critical to having a safe, good work environment. So again, preventative methods might include things around effective messaging, having proper alliances and positive group and team dispositions to create a positive team spirit, having nursing management that is really in tune with their staff and aware of what the needs are and addressing them before it becomes a panic type of situation or under the gun, so to say. Some of the reactive methods, it's obvious that within emergency services nursing, again, they are exposed to traumatic events on a daily basis all the time. So as much as you can be preventative in your goals as management, as an organization, there's always going to be some risk of burnout and stress based upon just the simple area and the demands of it. So being equipped with the proper tools and methods to react to when those situations occur is very imperative. Some things an organization or the host organization, ABC, should or could consider would include making sure that nurses have ample autonomy. Again, as previously stated, making sure there's a good team environment spirit that, where there's communicate and support for peers. Again, as stated earlier, the nursing management supportive in coaching and communicating, having a timeout room when such traumatic events do occur, having the availability of counselors on hand if needed to course correct after a traumatic situation may happen for nurses. Just making sure that nurses and nurse management have proper or are instilling proper coping skills. So maybe training around that. Again, these are ways that an organization can be a little bit more reactive, but if the organization is prepared for that when it comes, because it will come, just being in healthcare, they can do what needs to be done to address it positively. Recommendations for future research really reside around the research design. Again, as previously stated, looking at qualitative or mixed methods of research in these areas would always be a good thing, just to kind of get a pulse of responses to the questionnaires to measure relationships, as well as looking at interview responses to corroborate some of that numerical information from quantitative testing. And overall, just looking at testing in other areas, which could include looking at burnout and stress and factors in other areas of the hospital, such as ICU, some other areas in addition to the emergency services area, as well as taking a look at if years of experience is actually really focused on, then taking a look at generational diversity to kind of see how that may play into burnout and stress and how it's impacted by, say, baby boomers or generational X, or again, the generation Y, millennials. It's just interesting to put all those factors together. So just taking a look at research in other areas to see what can be found in terms of trends and patterns for management in the future. Overall reflection on lessons that I have learned, it has been challenging. It's not been an easy journey, but it has been worthwhile. I feel like I have grown in my writing skills tremendously. I feel like I've also grown in my faith through the process of this. The whole IRB process at my host organization was very tenuous, taxing, and it was very demanding. I am very grateful to God for our professor, Ina Maleritis, who has been just very supportive through the process, along with just prayer and constant referencing to scripture through paper writing, through the program, as well as outside through my own study has helped to strengthen me, just knowing that God will give me the strength to be able to get through. So I feel like with God's help, I've been able to work through barriers. I'm excited about this coming to a close and presenting this information and what management will respond in kind with it. Also, being an organizational change agent is pretty exciting. And having learned about that through the process is great. And just feeling better about research methods from this entire process. So I'm just grateful to God for the opportunity, and I look forward to closing this out. Thank you for your time and attention.